hit record. I do want to welcome everybody to today's NNLM R4 session. I have a mini PowerPoint that I want to put on my screen. We are super excited to have you all here, especially on Veterans Day. I welcome you to our second NNLM R4 Connections meeting through the network of the National Library of Medicine Region 4. Today's talk is super exciting and unique. We're going to have a librarian out of the University of Utah, Miss Donna Belushi, who's going to be talking to us a little bit about gamification. I was telling everybody earlier that I just met Donna and we totally hit it off via Zoom. I can't even say like in person or anything cool like that. I'm sure it'll still be cool in person, Donna. But we went off talking about how so much can happen when we talk about health information, how to spread health information. Donna is not afraid to go or think outside of the box. So this is a super exciting talk, and you know we're happy to have her here. So Donna, feel free to take it away. I'm going to go ahead and stop sharing so that you can share your screen.
Okay, hello everyone, welcome. I am so happy to have you all here. Assalamu alaikum. My name is Donna Belushi, and I am here at the University of Utah, which also happens to be the NNLM Region 4 office. So I have the opportunity to work with the NNLM Region 4 who are physically here on a pretty regular basis. And by that, I mean, I pop into their offices maybe once a day just to be like, hey, I need an outside perspective. And I just pop in because they're, we work together, but technically we are, a little bit separate in our work. And so I've always wanted to be more involved with the NNLM, especially because my colleagues are right here and I really like all the work they do. And Samantha Nunn came to me and she was talking to me about health literacy, and we just started chatting, and I talked about some of the things that I do when I work with students. And one of the things that came out of that is that I use a ton of gamification. So when it comes to health literacy, I use games as a means to try and get engagement and get people who normally wouldn't use certain resources to try them out. So here's my audience. My audience is almost always first-year college students. This is a group of the peer advisors to the LEAP program. I don't know what LEAP stands for anymore. I don't think anybody uses the acronym like individually, but LEAP is a first year and then a second year program that I've been teaching with for about four or 5 years now. And their library is integrated into the first year classes as a means of helping students who are generally from disadvantaged backgrounds to have this extra help through their first 2 semesters of college. So in most cases, these are teens, a lot of times they're 17, 18 years old. They are independent for the first time. Some are. A lot of them are still traversing what it means to take care of yourself in terms of your health. A lot of them are leaving their pediatrician to go to an actual, different family medicine. A lot of them are going to start going into healthcare. So that is the reason why I get involved as the librarian. Even though mostly what I'm teaching them is a lot of health literacy or information literacy, I infuse it with a ton of health literacy. I use it in a means of saying, like, this is something that you're going to be discussing with your patients one day. This is something that you're going to be helping others with. But then over time, I'm like, this is something you can use for yourself. This is something you can use with your family. These are some things you can do with your friends. And so it's a younger audience that is usually pretty tech savvy, but at the same time, I also address things like what health related Instagram accounts do you follow? Because they all do, we all do. And I want to know where they're getting that kind of health information. So one of my favorites that I love playing with them, and I play this with the first year, and there is a second year health sciences LEAP, but they don't have an integrated librarian. They usually just meet with me one time. And I love to play the database throwdown. And so I do this with my colleague, Nina Swanevel. And the two of us put this together as a means of getting students using all the different kinds of resources beyond Google. and to give them the feeling that they still get to use Google, still get to use Wikipedia. They can use these things, but it gets them to use other things and see the pros and cons of using those things in the realm of health literacy. So everybody who's in here, I know there's only like 7 of us, but it'll be fun. Everybody is going to play the database throwdown with me. So I'm going to open it up. So here is, let me move this over. I think I'll have to do presenter view. There we go. No one needs to see that part. Okay, so all of you can see this, right? The database throwdown. All right, so
Yes.
we're all gonna play along. You guys are gonna do phenomenal because you already know all this, but to show you like how it's gonna go through, go ahead. And so instead of demoing, here's all the different resources. This is how you use PubMed. This is how you use CINAHL. Who's heard of CINAHL before? You know, instead of doing that, we play a game to compare resources. So the list of resources that I use with the students is usually CINAHL and PubMed as more higher level peer-reviewed journal articles to kind of get them used to seeing what is probably not very, you know, it's not going to be super user-friendly. It's not going to be familiar. And then the library catalog, especially in an effort to get them to learn how to do like full text and opening up the PDFs or getting their textbooks. Google to give them something familiar that they're probably going to use. And then I give them Medline Plus, because Medline Plus is something that I know, having taught this for, you know, 4 or 5 years now, Medline Plus is almost a huge takeaway every time, where every student is like, I've never heard of this, this is great. And then by the end of just this game, a lot of times they'll keep using Medline Plus over and over again because they feel like they're getting what they want each time. So how do we do this? I get everybody into groups of 5. Sometimes, because now we have Zoom, sometimes I'll just do it individually and just have each student respond individually rather than groups, but it's way more fun when they're all in a classroom. And then I give them a hint just to like, just to give it like a category. And then out of the 5 that are together, each person gets to only use one of the 5 resources. And they have to stick to it for the entire question. And then each question, they have to switch resources. And that if they really want to like make it more difficult, then it's like, if you use a resource once, you don't get to use it again. So for each question, if you use Google on the first one, you don't get to use Google again. Now you have to use CINAHL. And then when you think you have an answer, raise your hand. Raising your hand as well on Zoom works. And then after each question, we take a minute to talk about it. Why is one easier to get the answer than another? What is more effective? What is better if you're talking to your grandmother versus talking to a patient versus looking something up for yourself? So you pick a source, you get the answer. That's it. So here's a practice question for everybody. Are you ready? Okay. The category is disease symptoms. So remember, so if you want, go ahead and pick between the 5 were CINAHL, PubMed, Google, the library catalog. You can use your own institution. And what was the last one? CINAHL, PubMed, Google. Oh, Medline Plus. So go ahead and pick one of those for disease symptoms. And when you're ready, here we go, practice round. What is a symptom of rabies? Go ahead and raise your hand or put it in the chat. And Liz got it. Fever, headache, nausea, vomiting, agitation, anxiety, confusion, hyperactivity. Fantastic. And Liz, where did you go? You can use the chat too. You don't need to, you went to Google. Exactly. Right? So here we are. What did you use? Google probably. But if I had other choices, I tell them like, hey, did you know there's even other things? There's UpToDate. If you're planning on going into pharmacy or you want to start looking up drug references, UpToDate's a good one. Or did you know that there are veterinary manuals that you have access to here at the university? I've used the veterinary manual when I've noticed when my dog got an eye infection, and I was able to see like, is this serious? Will it clear up on its own? Do I need to call the vet? And so, you know, initially It's like we're only using these 5. Did you know there's even more? They're even more nuanced. They're even more specific. Some of them have mobile apps, you know, to really get students working on it and thinking about it and recognizing right from the get-go, Google isn't bad. As a librarian, I'm not saying Google is bad. I think Google is bad because ad revenue and the, you know, there's different reasons why I don't like Google. In terms of finding information, Google is not bad. Google is just sometimes not the best. And that is something that I try to teach all the students are from here. Like, I'm not telling you not to use Google. I'm telling you to use Google effectively. So then we go on to let's do this. Let's go on to the actual thing. And so even though the points ultimately don't matter, like I tell students, like the first one gets a point, or each group gets a point, the points become arbitrary because like 2 groups will be like, well, I found this on this one and I found this on this one, but which one is the better information? And I'll be like, okay, half point for you, half point for you. Just like turning it into a really energetic exercise where people are feeling competitive, but in the end, there is no clear winner. You can say team whoever won, but that's not what gets them using everything. And in the end, especially when you're doing it now on Zoom, there is no clear winners. There's usually nobody. Everybody is just sort of learning together, but the competitive gaming nature of it gets people actually wanting to use different pieces. So then question 1, it's going to be a peer-reviewed journal article. And in a lot of cases, you can see where students struggle with this one because they're not entirely sure what this means. They don't really know what a journal is. They don't quite know what we mean by article. And in a lot of cases, they get peer-reviewed, but they're not totally sure, like, how is this not a textbook? And this is a really clear way to get that across, you know? So find a journal article about hand washing. And usually it's CINAHL or PubMed, and this tells them, like, when you're looking for peer-reviewed journal articles, especially when you're doing research for your classes, this is where you're going to find them. But then we ask the students, like, did you find anything good somewhere else? Did you find something great here? Usually at this point, I'll ask all the students, did anybody find out why we wash our hands for 20 seconds? And that's when they're like quickly going back and they're like, wait, hang on, you know, and because there isn't necessarily an article that says 20 seconds is the exact time, but then it's like, okay, well, where did that come from? And then making them dig a little bit deeper. Next one, give me something easy to read. This one, of course, I'm sure a lot of you could guess. Does anybody want to guess what the answer is going to be for this one? You can drop it in the chat if you want.
Medline Plus.
It's Medline Plus. So this one is a good one because it gets a lot of students to see Medline Plus for the first time, to use it for the first time, to be familiar with the formatting. And this is the biggest one. I would say every student usually starts using Medline Plus over and over and over again, hoping for answers, because I think it feels a lot less daunting than PubMed or CINAHL, but it feels a lot more constructive than when they're just going to Google. And then we're asking for just the basic facts. What degree do you need to become a licensed physical therapist? And this one is fun because becoming a licensed physical therapist in Utah or in Colorado or in a couple of, you know what I mean? Like it is a little different between different states. And so you can see where they start looking it up and almost immediately they're like, wait a minute, I have a question. Does it matter what state? Like, is there like a licensing board federally? And then immediately we've got a conversation going. Students are debating who gets what points. And then I start giving out pretty arbitrary points at this point where I'm like, you get like 3/4 of a point and you get like 1/4 of a point because you asked a question. And in this case, usually Wikipedia or Google. And then this one, for all the millennials out there, you can sing it in your head. And part of the reason why we use veterinary medicine in this one is because the University of Utah does not have a veterinary school. So we know that none of the students would have already had like any preconceived idea of what to find. because I think in the past I did things like find a book about anatomy and almost immediately they just type in Gray's Anatomy and they'll find it. So we used something different, like the history of veterinary medicine, and it was fun to watch students use Google for this one. So almost always they're like, oh, the library catalog took me where I need to. Then we get to have the conversation of, did you know with the library catalog, you don't have to pay for the book? How many of you used Google? How many of you got links to Amazon? How many of you don't want to pay $400 for a textbook again? And then that creates a different way to just like have better rapport with the students and tell them like, we are here to help you get resources for free. We want to make sure that you don't have to spend money if you don't have to. If you really need to get access to something and we don't have it, let me tell you about interlibrary loans. And then I think this is the last question, and I added this question for this semester. And I added this question for this semester because the age group that has the most COVID cases is 18 to 25. And I wanted them to know that, because when they look this up, when they start typing in these words, the top, they're all going to go to Google, and the top thing they're going to get is either Google, it will automatically pull up like the like COVID numbers on the actual Google page, or it'll send them to the Salt Lake County Health Department dashboard, which is like this really incredible, very dynamic. I'm pretty sure most health departments at this point have been using it. A similar instance where they have a lot of all the data, but it's boiled down into these really great like data viz where you can see graphs and you can see by zip codes, you can see by age, you can see by all kinds of demographics. And so I asked them to look at the age groups, and when they look at the age groups, they see they are the biggest age group. And then I just let them know that, you know, I want them to stay safe. I want them to remember that this is still a concern. Wear your masks, get vaccinated, please, all that stuff. And so this, you know, ends with a, hey, I care about you. I want you to know that I want you to stay safe. I want you to stay healthy. And then they did it. They made it through 5 questions. Usually at this point, we are pretty close to time in terms of an hour, because students will start either arguing who got the most right answer. They'll start asking about different, they'll be like, well, I used this and I clicked on a CDC link. So I think Google to CDC would be even better than if I used Medline Plus. You know what I mean? Like, they'll be debating how good resources are depending on where they are in the resource, you know, point. And it gets everybody thinking about health literacy. It gets them thinking about like, how good are some of these resources? Where do we get our health information? What is the best thing for each thing? And that there isn't a blanket, there isn't a really like obvious blanket way to get to where they're going. So then we wrap up with a question where I start talking to all the students, like, what do you feel like you learn? But more importantly, what do you feel like, what has this opened up? Like, what do you want to know more of? And then the big thing, of course, like, did you notice there was any bias? And everybody's like, well, Google had a lot, but the other ones didn't. And it's like, aha, but they all have bias, you know, and get them thinking and talking about that too. And to see, like, you know, if you made a table between the different things, are you gonna, you know, with CINAHL or Google, are you going to get scholarly articles? Yes. And like, sorta. And they'll be like, what about Google Scholar? Is Google Scholar good? And then, are you going to find memes? Well, no, but yeah. Do you like memes? Do memes get information to you better? Yeah, sometimes. Most of this, almost, before it was 100% nursing students, I would say now it's probably more like 75% are nursing students. So usually by introducing them to CINAHL, it's like, okay, well, are you finding what you need for your major with nursing? And then, are you running into conspiracy theories on here? And then the very simple, very obvious, did you know that there's medical librarians and we want to help you with everything? Do you need help with your research project? Do you need help formatting your citation? Do you want to know where the best food is on campus? Just you can reach out to us for any of these things. Like, our job is here to help facilitate your time and to make sure you succeed. And then I tell them the usual stuff. Like, I want everyone in here to get an A. I want you to get an A. Come to me and I will do everything I can to make sure you get an A. So to jump back, let's see, there we go. So that's a database throwdown. That's just one of the games that I use. One of the other ones, so that one's the most fun. That one is easily the most dynamic, and that one is the best one that I've been able to have go from being in person to Zoom and still have it work generally.
Oh my goodness, I'm ready to throw down with all these people.
It's fun. It is fun. And it is one of the few times I've actually gotten students to open up in a very early class. Usually they want to be quiet. They don't really want to engage with me very much. They think my energy is probably a little too high for 8:30 in the morning, but usually getting them to play a game usually starts firing some of that adrenaline and gets them going. And it's a great start. This is the game of research. This is something that I can't remember who developed it first, and then some librarians here a few years ago started to tweak it to be more health related. And so you can pretty much take this and fill it with whatever you want. The game board itself is basically works like the game of life. Just roll a dice and move however many numbers. It's not too complicated. And you're collecting money and answering like topic questions. So the main point of your research is that you are talking about these with your group. And when they're playing, like, you know, the two teams are basically working on this together, and some of the questions that they get are stuff like, this is usually the second semester or second year that will do the game of research. So they've had a little more time to be involved and take some classes. So some of the questions on there are pretty, they are very ethically gray, is what we try to do, so that there's never anything definitive where one team can say what and then the other team goes, yes, you're right. Like, we want to create something where there's a little more like, oh, well, how do you work with that? And so things like, how do you engage with patients with end of life decisions when they're still in good health? We're like, have you heard of advanced directives? A lot of them haven't. Does violence in video games impact player emotions and actions? There are scholarly articles that literally say both, yes and no. And so like, so, okay. And then, should all babies receive prenatal genetic testing? That one usually, like, the game goes wild at that point, because when you start talking about, like, you know, prenatal and you talk about genetics, there's all kinds of questions. And there are so many students who have so many thoughts and opinions or things that they've seen in pulp culture, or whether or not they heard of controversy with CRISPR. And, you know, that one usually, most of the prenatal ones in there usually get things going. And then, you know, you get money with a little piece of the paper with money. And so, you know, going into something, these are all the high level $300. There's little $50 ones where you just, you know, briefly cover topics. But then there's stuff like, you know, you misread the assignment, you lose $50. You only use Google, you lose $50. Let's see, take broad topics and make them more focused, then you get $50. And then when you get to the end, depending on how much money you've made, you can either, you know, do some extra credit, or, you know, you've made it and you get the scholarship, or you get your research funded, or you get, you know. And so this is working someone through their health literacy at the next level in terms of research and how to get research funded, or what are the things that might block your way. But mostly it gets students talking to other students about a lot of ethical questions, couched as sort of a very, very like generic version of life. And this one is not necessarily about health literacy. However, I use it to talk about the ways in which bad medical information can spread. And so Breaking Harmony Square is a computer game. It's very, very simple. I can actually do a quick to show you how it works. And so this is an assignment that I usually give for students to just do on their own. So it starts with, you're hired, and you're like, welcome to your first day as the chief disinformation officer, you know? And then you pick a code name. So you pick a person. Where it's like, wait, are we the baddies? Yes, we're the baddies. We are the ones that are going to spread bad information. And it's so because there, you know, as you can see, there's always a ticker up here about what's going on. And as you go through it, so it's saying here we go, a perfect trolling topic, Harmony Square Swan has escaped again. So how are you going to do it? Are you going to kidnap the swan? Are you going to turn the issue into a heated debate? So let's write a post. And you can write a post, and these are supposed to be like in the newspaper. So to care about the stupid swan, post it. And so immediately you get someone upset. And right here, you can see your likes. This is supposed to be like social media. So how many likes you get is based on how inflammatory you're being. So as you keep going, you started a flame war. What do you want to do with this? Escalate it. Post it in the group. So you automatically, each time you do this, your likes go up and they go up and they go up. And after doing, having the students just go through that on their own, what I end up doing is afterwards asking them, what do you think happens when somebody says that vaccines make people die? Or what do you say, you know, like, what do you expect to happen when someone claims that, you know, they're magnetic? What does that cause? Knowing, having you know, played through this game in a really like low stakes, very like over the top way of how bad information spreads, it vaguely gives students the just gets them thinking about something that they're probably very aware of already, but then just creates the way to talk about it in a sort of like quick, funny way. I think you can play through the whole game in about maybe 10-15 minutes, and then their assignment is simply, what do you think about that? Have you ever encountered this in real life? And that isn't all. I do so many games in so many ways. When we had to go 100% virtual with some of our teaching at first, we tried to come up with a couple things that we could do just virtually. And one of the ones was like a choose your own adventure using Canvas modules, so that each time you chose one thing and then you would go, it would give you one of two things, and it sort of just created a path of what you were following in terms of the module based on your decisions. And it was probably more like breaking Harmony Square and the research game kind of stuck together, where each time you just had to pick from this or this, and then if you picked that, it went here and went here and it went here. And I think altogether there was probably only about 5 levels, because then I would have completely taken over Canvas if I kept going. I do a lot of trivia. Trivia is a really, really basic game, but it's pretty easy, and you can do it in person over your social media. Right here, I wasn't able to give students tours of our library like I normally would. I would invite them up to our library and have them come hang out and have them feel like they were a part of the health sciences campus. And because I couldn't do that, instead, I took some things about the library to show them in photos. And one of the things I was showing them was our history of medicine collection. And I turned it into a little trivia thing of like, hey, what is this? What is this thing? We also have card games. So there are tons that are pre-made out there that if you go and look them up, or you can make it, you can basically just take a game that you already know, like Go Fish, and then you can instead switch it around to be full of a bunch of health literacy topics that get people talking. Board games are also really easy. Like the game of research is based on the game of life. If you wanted to take another board game and then just switch all the words to health terms, you basically got a health literacy game. As far as I can tell, just about any game can be modified to be about health literacy. You just change some words. Oh, it is a railway surgery kit. I did not say. Yeah. So what this actually is, we received this from someone local. I think they were a relative. So etched into the side of the case, it says Dr. Fouts. He was, I'm going to say ophthalmologist, but at the time he would have just been considered a railway surgeon. But he specifically worked on eyes. And so what this was it's like about this big, a little bigger than maybe like a smaller cigarette case, you know? And so it would have been something you could just keep in your coat pocket. And all it would have had was this injector with 2 different needles. And then the 6 holes would have been different vials, which would have been probably mostly alcohol at the time. And then later on penicillin. And so what this was a railway surgery kit, in that there was, when transportation was primarily by railroad, there were people that still got sick, but also when they would stop at certain towns, people would come to be trained knowing that there were a doctor on board, and sometimes that might be a doctor that they could just see. And so there was a doctor who was, their job was with the railroad, and their job was to be on the trains all the time, crisscrossing the country, helping people on the train, as well as people who came to the train at different stops. And so this was just a little kit they could keep on themselves that had just a couple little essentials. Yeah, history medicine, I will say, is like the showstopper, adult to children, doesn't matter. Creepy medical stuff, everybody wants to come out for. So if you can get people, if you want to get students involved that really seem disinterested, pull out a bone saw. Suddenly everybody wants to get involved. And so this is it. And so here are some topics for further exploration that I really want to work on. One of my big ones right now is sexual health. I also do zines as a means of very easy transference of knowledge. And I have these little one-page zines that are sexual health in Salt Lake City. And I primarily gear it towards teens, and I give them local phone numbers and websites of who they can get a hold of confidentially if they need to have any sexual health questions or concerns that need to be met. But if you want to look it up, there was a national survey in 2017 or 2018 of medical students admitted into medical school, and they scored below passing on a sexual health test. They were specifically, I think the lowest grades were in STD prevention. The other thing I would love to do is take these games to high schools. A lot of the students that I'm working with, even though they're 17 or 18, some are 19, they are already in college, and they already have the plan of, I want to be a nurse, I want to be a PT, I want to be a doctor. And I think it's more important to try and shift to just a little, because it's not like high school students are like, there's some huge divide in terms of the brains of the students I teach in high school students. So I would love to take it to high schools before they already think they know what they want to go into or what they want to do, and instead start there, when right before they get to the point of being independent and needing to figure out, well, how do I get a primary care physician? How do I go to a doctor that isn't my pediatrician? How do I go to a doctor, or what happens when I'm off my parents' insurance? Stuff like that. And then the other thing that I would love to work on, because I do it personally, is natural medicine. The number of times I run into someone, specifically my mom, who says, I want to get this tea. I heard about it. I think it'll be really good. Where can I buy it? And usually the first thing I do is make sure that it doesn't interfere with her current medication. And then I say, yes, it's okay for you to get. You can have dad pick it up at the Sprouts or, something. Or in the case of certain things, I'll say you know what, this will actually keep your thyroid medication from working very well. So I think it's better that you don't use that one. But if you're interested, you could try this supplement or this tea because this will help. So.
And that is actually a really good topic, Donna, only because, you know, in my experience working as a medical librarian along the US-Mexico border and working with minority populations in particular, we've run into a lot of people wanting to use supplements or natural medicines because they think they harm your body less than, you know, prescribed medication.
And I think with, at least in the case of like my parents, it feels like, I think to them, it's this like very low stakes, easily accessible thing that can either be, that it's not taking the place of medicine, but it's somehow like doing an extra job for something. And my mom loved the idea of a tea as opposed to something else. And when she finds out that things come in tea form, she really wants to get one. But sometimes those things can interfere either with my dad's like high blood pressure medication, thyroid medication. And I usually gotta be, I really gotta double check of like, let me just make sure in the natural medicines database that there's nothing that says whether or not this is gonna affect this medication before you just run out and buy whichever tea you wanna get, you know?
I like that, Donna. There's a comment in the chat that says, you know, you got to be careful about leaning towards medical advice. And I do agree with that.
You're so right,
as medical librarians, we do got to be very careful with that. But, you know, as medical librarians, also what we want to do is increase health literacy and empower our communities to be able to find information that can better help them make decisions, healthcare decisions, right? So ultimately it's up to the person itself, but I think it's essential that we put these resources out there so that they're able to make those decisions.
I totally agree, Sean. Yeah, it's different because I'm talking to my mom most of the time when it comes to this. But I do occasionally have friends that'll be like, oh, you got a cold? Here, let me get you some oregano oil. And I'm like, you know what? I think I'm fine. I'm gonna take acetaminophen instead, you know?
It's funny that you say that, Donna, because I sit in the same, you know, seat you do. I do look into a lot of this medication for my mother, also for my husband, who's actually, he was born and raised in Mexico. And, you know, there's that culture ingrained, the tradition, you know, where they're always looking for natural remedies and try this or try that. And he does it a lot with the kids. And sometimes we gotta look at resources to make sure we're making the right decision.
Absolutely. So does anyone have any questions? Does anybody want, I can definitely send you links to any of these resources if you want to use them. I'm more than happy to share all of this or help you. If you have an idea for some gamification, I say go for it. It has probably been the #1 way I have been able to get through to teenagers who generally think I'm probably old and too high energy.
I love it. I think this was a wonderful conversation. If you can share those resources with us, Donna, that'd be great, especially with me.
Of course.
I will go ahead and put it out to the region also and share it in one of our blogs. Does anybody have any questions or comments for Donna that you want to go ahead and put out at this time? So Sean mentions these games are both fun and effective. Thank you for sharing. Carol says, I love games and I wish that it could be a part of grad school. Yes, I totally agree.
It can be. Why not? Why not?
That's right. We just need more high energy people to put these out there and be super excited about gamification.
And here's the thing, you can completely change all of the questions that are being asked here. You know, you can, most of them are pretty generic trivia board card games are usually what I see. And then all you do is change the topics to the level of who you're speaking to and the topic that you want to cover. I think grad students could absolutely do gamification. And that's my email that's in the chat in case you want to get hold of me for anything. I love collaborating. I love meeting others in the NNLM, other medical librarians.
Well, thank you so much, Donna. I think this was a very informational and awesome talk. Donna is sharing her email on chat so that we can go ahead and get a hold of her. I do want to thank everybody that was able to make it to today's meeting. In particular, Donna, I mean, that was a wonderful talk. We learned a lot from you. And, you know, I'm a total gamer and I had never really thought about some of the games that you put out there. And I think that I'm going to be doing a lot of those throwdowns and a lot of different games with some of the people that I interact with. So I'm super excited to have had you here to talk to us. I do want to remind everybody of our next NNLM R4 Connections meeting that will be taking place January 13th, 2022. So happy New Year, everybody. Happy holidays. Enjoy your time off. We're super excited to have you guys back in January. Same time, same place. Stay tuned. We're going to be deciding the topic as we move along. You can join our listserv. You've got a URL there, or you can visit our blog at news.nnlm.gov/region4/blog to learn more about some of the activity that's going on in the region. Maybe you want to share something, feel free to reach out to me. I'm more than happy to, you know, feature you in one of our blogs. And this is also where we share information with the region as far as what topics we'll be sharing with NNLM R4 Connections. So I do want to thank everybody for attending today's meeting. Donna, this was wonderful. If anybody has any closing remarks, feel free to jump in. If not,
Yeah.
I want to thank everybody for your time and have a wonderful Veterans Day.
Yeah, thank you all so much for coming out. It's so good to see so many familiar faces, but also new names and faces. So feel free to reach out to me with anything. I'm, you know, this is just one of the things I'm passionate about.
Awesome, awesome. So in the chat, Donna, you're getting a lot of thank yous, and thank you for food for thought. So if you can share, like I said, some of the URLs to those games with us, that'd be great. I'll feature you on one of our blogs, and then we could go ahead and get that out to the rest of the region also.
Sounds good.
Awesome. Thank you. Have a wonderful day, everybody. Enjoy the rest of your day, and we will see you again in January.
See you, everyone.
Bye.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine.